Hi, everyone, and welcome to today's Safety and Health webcast, Managing Health and Safety Risk in a Post-COVID-19 World. I want to let you know that you're in the right place. We're just going to be getting our presentation underway in a little under 1 minute. So again, we welcome you and invite you to get settled in. We'll be starting in just about a minute. Hello to all of you joining. I want to let you know you're in the right place for managing health and safety risk in a post-COVID-19 world. Going to be getting going in about 30 seconds, just letting folks get settled in. Okay, well, again, everyone, we welcome you and say thanks for joining us for today's Safety and Health webcast, Managing Health and Safety Risk in a Post-COVID-19 World, sponsored by Fulcrum. My name is Kevin Drewley. I'm an associate editor with Safety and Health magazine, and I'll be moderating today's session. Thanks for joining us. We hope you all are safe and well amid the COVID-19 pandemic. We also ask that you please take a moment to honor those who have lost their lives on the job as we commemorate International Workers' Memorial Day today. In a few minutes, we'll start the presentation, but first I want to go over some preliminary items. The views of today's speakers and organizations are their own and do not necessarily reflect those of the National Safety Council or Safety and Health magazine. Any mention of a commercial enterprise, product, or publication doesn't mean the council or magazine endorses those items. At the end of today's webcast, we will conduct a question and answer session. To ask a question, simply click the Q&A button at the bottom of your screen, type your question, and click the send button. Feel free to ask your question at any time during the presentation. You don't have to wait for the question and answer session to begin. We'll try to answer as many questions as possible, but because of the large number of participants today, we might not get to every question. Any unanswered questions will be forwarded along to today's speakers. At the end of the webcast, you also will be asked to complete a brief evaluation survey that will appear on a separate screen. We will let you know more about that after the presentation. This webcast is archived, so you can access it after today's live event. To view this webcast and all of our past webcasts, go to safetyandhealthmagazine.com/events. You may also receive a link in a post-event email. With that, let's go ahead and get started. Our speakers today are Keith Hull, David Janicki, and Jake Freevald. Keith serves as director of TSM UK Consulting Limited. He is a specialist in international accreditation and the implementation of behavioral management techniques in health and safety. He is a member of the Council for the Institution of Occupational Safety and Health, a global safety body, as well as a fellow of IOSH and the International Institute of Risk and Safety Management. David has spent nearly 10 years working in various EHS positions, and in March 2020 created Safety Nights in response to a lack of communities dedicated to health and safety professionals. Since then, Safety Nights has expanded its influence to over 1,800 users. Jake is head of product marketing for Fulcrum and works with the Fulcrum team to modernize the mobile workforce. Jake has spent his career in technical and marketing positions using data to help people run their businesses more effectively. Again, we thank you all for being here today. We'll be having a panel discussion today with Keith, David, and Jake. So gentlemen, if you're ready, we will go ahead and take it away.
Sounds great.
Oh, I'm sorry, go ahead.
No, sounds great, thank you.
Oh, you bet. So the first section, we're going to address COVID and safety challenges. We all know this pandemic has affected every aspect of safety processes, management, and accountability. So let's talk about how the trajectory of the safety industry may have changed. We'll get it going with a polling question. We're going to be asking, where do you think the safety industry is headed at this phase of the pandemic? So you see the responses there, and we'll give you about 30 seconds or so to let you know let us know what you think.
We definitely need people to vote on this because I've got a big sign in front of me that says hosts and panelists cannot vote. These are definitely your opinions. So come on, press those buttons now. It'd be fantastic.
My vote doesn't count.
No, our votes don't count at all, David. I think it's fantastic, though. What have we got online right now? We've got over 200 people online right now. It's fantastic, isn't it?
It's fabulous having that many people interested in the topic.
Yeah.
For sure.
There we go. Majority says some changes are permanent, but we'll be relaxing some aspects of what we do.
So about
60%.
2/3 say that. Yep. And the
That's
other
probably
two,
what I would have guessed. That's probably what I would have submitted as well. So
Well, we had a little bit over 80% of precincts reporting. So we'll echo Keith's plug is we are going to have a few more polling questions throughout this discussion today. So with that, we will get our first question going though, and it's to David. David, what new challenges arose with the pandemic?
you want me to list all of them? No, I'm just kidding. How long we got? No, so obviously, I'll be answering these questions from a, health and safety professional standpoint. You can interpret these questions from like any realm or industry, but yeah, I mean, as far as like health and safety goes, probably the biggest challenge I think the industry faced is like what to actually do when people got sick. And it's not something like, if you had an employee get sick, it's not, something that we're used to really dealing with. So, I think depending on your company and your industry, if you're like a 24/7 operation and, if a third or second shift worker gets sick, you might have to make some shuffles, in terms of, shift changes, contact tracing, who else on that shift may have gotten sick. And I think that's kind of like something that pretty much every department would have been involved with, from health and safety to like human resources to the operations department, in terms of like making those changes and figuring out how to like, structure your shifts if someone got sick. So I would say in terms of like challenges, at least from what I've seen, that was probably the biggest curveball is when people actually got sick and got COVID. Because, no one really is like trained to know what to do, especially within like a month of learning of like lockdowns and stuff like that. And I think another challenge is just making sure the workforce, follow the state and the CDC guidelines. I think it comes down to how disciplined your workforce is. A lot of the workforce had to go remote. A lot of the workforce didn't have to go remote, so or had to stay non-remote rather. So trying to make sure your company, your people are following those procedures, I think was probably challenge number 2. So those are my 2 biggies right there. Figuring out what to do when people got sick and how to manage, social distancing and making sure you're following the recommended guidelines.
Which of these challenges, Keith, do you feel are here to stay?
Well, I really liked, and I've got to say, firstly, thank you for having me here. It's a great platform, and it's I'm really great honor to be speaking virtually from the other side of the world. But really looking at that polling result, one of the really interesting thing, and thinking about changes being permanent, just think coronavirus is related to flus and colds. Companies like Beecham's, companies like other cold and flu manufacturers at the moment are kicking themselves. They've built a industry out of presenteeism. 3 years ago, if you had a cold, if you had the flu, you'd have probably taken some medicine, you'd have gone to work. And the real change that we've definitely had within culture around the world, if someone has got a slight cold, a fever, isn't feeling well, you haven't got leaders of industry going, you'll be all right, come in, take some hot lemon, take that. It's no, stay home, don't come in because of the severity of this. So we've seen this seismic change in terms of presenteeism and about people coming into the office to get their job done, even when they felt slightly under the weather. And I think that's the real thing that's probably changed, is that people treat people being unwell at a time of work differently than they probably did 2-3 years ago, because you would have struggled on. Now, if you're unwell, you're told by the company you work for, don't come into work. So there is this real change in the way we're treating people in terms of presenteeism, and about how they're how we're actually making sure we keep the rest of the workforce well and we look after their well-being.
Jake, this one's for you. How do you minimize the disruption caused by changing safety protocols so they don't interfere with productivity?
Thanks, Kevin, and thanks for being here. I think I'd like to start this answer, and it's a critical question for us at Fulcrum. I'd like to start this answer by actually bringing up another couple of polling questions. The first one is, how were you managing safety pre-pandemic? And the reason I ask that in this context is that we're talking about changes and the kinds of changes that that COVID-19 has brought upon us. And what we'll be asking right after this is how you're managing safety now. So you start off with some of the typical ways that people were managing safety. They were tracking their inspections on pen and paper, or if they started the digital journey, frequently their first step into that was by creating spreadsheets and making sure that everyone had the same spreadsheet. Some people actually have either custom built applications or potentially prepackaged applications that help them gather safety information. And maybe some of you are using something else. So pre-pandemic, how are you managing your safety programs? And I think we've been gone for about 30 seconds. So if we look at the results of that, mostly spreadsheets wins at about 40%. So people have been taking that first step into digital digital transformation. A lot of people still using pen and paper, about a fifth of us, and with custom applications, almost 30%. So, and I don't know what something else is, but that's very interesting, and it'd be interesting to talk about that. I think the important thing for us to think about with respect to managing changes that took place during COVID is that the spreadsheet and paper approach caused a great deal of difficulty because version control could be so difficult. If you're using pen and paper, then you have to create new versions of the documents that you are using to move that out. You have to create new versions of the spreadsheets that you're using in order to make sure everybody's working off the same ones. You're doing things like email distribution. Manual distribution might not work because people might not want to come into the work center if they don't have to. So, so a lot of version control issues came up as a result of managing that with pen and paper and spreadsheets. I don't think we brought up the how are you managing safety now. Can we raise that as well? So the interesting thing to see here is, has that changed? Has the fact that we're being more distant, the fact that we're not showing up to central locations as much, has that changed what what our approach is for managing safety? And again, same questions: are you using these same formats now, or have you made a change from COVID? I think that's one of the more intriguing aspects of this question. The variability within these different methods is something that will come out, I think, later when we talk about communication. Again, mostly spreadsheets. We've decreased our reliance on pen and paper. It's forced some of us to move into that kind of digital realm a little bit more. But how we use digital information to communicate is going to become a really critical part of our the next section of our discussion. One of the key things that we do at Fulcrum is make sure that you have the rigor that you need, that you would get from a paper checklist or a spreadsheet that contains the kind of information that you need, because it's an app on your phone that you can use, or tablet, that you can use to get exactly the right answers that you're looking for. but it's being designed from the ground up without using code. So it's much more rapid. It's much easier to change. There's a much more rapid turnaround time for changes. And I think that kind of flexibility is highly necessary in safety right now, while still maintaining the kind of rigor that's necessary in a safety program. Kevin?
Thank you, Jake. No, as you alluded in your answer, we're going to shift now to talking about some communication challenges.
Could I just make one remark on the original poll? What was it? Where we're like heading in terms of COVID. Yeah. So I like most of us said, we're probably going to end up in a spot like slightly pre-pandemic and with additional restrictions. And I agree with that. I think like CDC is still going to have its recommendations. I think, companies are still going to advise, following those recommendations. But I think in terms of like, at least in the United States, I think state mandates are going to start lifting, and we're already starting to see that. And I think with that, we're going to see a pretty like sharp increase in economic activity and economic growth. And obviously this is all like, my predictions, but I think with that economic growth and as things start to open, we're going to see a lot of like new jobs and stuff come on the market. So I think one thing that we as safety professionals, like, we're very like focused on like COVID right now, but I think like one of the aftermaths of COVID is going to be some economic growth. And I think there's going to be a lot of new jobs, and, our companies that we work for are going to start growing. So I think people should take a look at like their new employee, like onboarding training and stuff like that. And see like, hey, are you able to handle like, 10 new hires in a couple months time? So, that was just one thing I was thinking about. Last night I was like going out to, going over to a friend's house. I saw like, a lot of like restaurants and stuff we're starting to open up. So, I think we're going to start seeing some economic activity, and from a health and safety person standpoint, it's like, well, maybe that means new hires, and how are we going to train those new hires up? So that was just one remark I wanted to make on the poll.
I was going to say, David, you've got some really good historical evidence from that as well. If you think about the 20s, which was definitely a party time, and you think about the 60s, both of those, see, unfortunately, you're probably not old enough to remember either, but those are both times that the 20s follow Spanish flu. So both of these times when society grew exponentially and people went out and started meeting again were followed by particular lockdowns. So you do have some real historical thing. And I think as you're quite agreeing with you there, people are really going to start to see this growth. But we do have to be mindful as well that because there has been this downturn, people are going to be worried about speaking up when there's things that they perhaps want to raise, because people may be in a case where they're fearful for their job. So previously, where we've got to a culture now, and especially the work you've been doing, where people do speak up better, they raise hazards, they have safety observations. Now, if you think, well, if I raise this safety observation, am I going to be seen as a troublemaker? You are going to get, and we do need to be really mindful as safety professionals that we are ready to support these workers in terms of reporting the right information to the right people at the right time, so that we can still get everyone home safe at the end of the day.
Thank all of you. So much of what you said is going to segue into our next topic, and that's communication challenges. Really talking about managing safety processes leads directly to the problem of communication. Safety professionals communicate in a huge variety of ways, ranging from the tactical, something such as tailgate briefings, to strategic communications with board members, and really everything in between. So with that, let's talk about how we're reaching out to and listening to our staff. Once again, we're going to get you going with a polling question. And we're going to ask, what aspects of communication have been impacted by COVID the most? So this is multiple choice, so we ask you to choose 3 of these.
As we were talking among ourselves about what kind of communication we wanted to talk about on this webcast, on this panel, Keith and David and I were looking at the need for real tactical communications. So your morning tailgate meetings, just sitting there and making sure that the people you're sitting there face to face with understand the safety hazards in a certain situation or what the job entailed. And then how that rolls up across multiple levels. So it's not one level or the other. It's not tactical or strategic. An accident review can be at the department level. Overall reviews can be, at the strategic level, because they can affect things like, your bottom line, your EMR, and so on. So, so there's a tremendous amount of variety, I think, in the kinds of communications we need to face. Keith, you might have something to say to that too.
Absolutely, and I think it was a really good conversation. And I know the poll's gone, and I just wanted to, for our colleagues that aren't based out where you guys are in America, obviously a tailgate meeting is a toolbox talk to many people in Europe, and in America it's exactly the same thing. But it was news to me as well. I didn't quite know what a tailgate meeting was, but it is key from that we are looking at in terms of with COVID. It's making sure it is that right information to the right people at the right time. And we need to make sure is that we still maintain that communication, despite the fact that COVID is forcing us into different communication channels.
As we get going now and into the questions for this section, David, just how did communication change during the pandemic?
Yeah, I mean, I think the cop-out answers, we all started using Zoom more and, Teams and stuff like that. But I mean, honestly, those platforms already really existed. I think the biggest shift in communication was for, the essential workers, the non-remote workers, like how they communicated with, the remote workers, and how the non-remote workers communicated with non-remote workers. And I think, COVID kind of forced everyone to take a step back, and, obviously we want to limit our interactions with people. So, if there's a construction job going on, or if you're on, construction site, maybe you don't want to be there for every single morning, tailgate meeting or, something like that. So I think it kind of was like a test for how strict and disciplined your workers are, and how good your programs were to begin with. If your workers were, diligent about doing, tailgate meetings and stuff like that before the pandemic, then, without that health and safety, presence there constantly, did they kind of slip a little bit, or did they keep doing it? So I think that's one thing. I guess it's not, did communication change? I guess that's kind of an answer to the question, but yeah, so I think it kind of tested your, the company's, I guess just how disciplined they were. And then, I think obviously remote workers communicating with remote workers, but, people were already using these tools to begin with. Now we're just in a different environment with dogs barking and kids screaming. So I guess working through some of those variables may have been a little different, but yeah. I guess I think the big thing was testing out how disciplined your workers were, because now they have recommendations from the CDC and state guidelines, so you got to make sure they're following those as well. So I think that's where the challenge and changes came into play, was those in-person meetings that you couldn't make remote.
Now we turn to Keith. Keith, talk to us about the importance of feedback loops in your field and the importance of listening.
Well, I absolutely love this question. I love the response, and I was really interested to see that training was one of the ones that people thought was affected the most. When we're thinking about things in terms of training, a lot of COVID shut down sites, shut down offices, shut down classrooms. So you might have had training, but it's a bit like riding a bike. They say you never forget to ride a bike, but I can guarantee if you haven't ridden one for 10 years and you try and ride a bike again, you're a bit wobbly to start with. And the same with training is we do need to make sure, as part of this training, part of this feedback loop, is that there will be people that have been trained just before they stop going to work. And now they might have skills fade and not be, you know, if I train you in something a year ago and then said, right, go and do that, you've got to suddenly remember training you did a year ago without picking it up. So that's where, in terms of this active listening, and I'm looking at the question that's come through from Bonner Chul, email is part of communication. I think we're not talking about the specifics. What we're talking about is in communication, how we're making sure that actually we're actively listening to people. And what we're doing is we're making sure that we're listening, taking that feedback and feeding that back into the people we're trying to support. Because if people are actually communicating with you and telling you what you need to know, but you don't actually let them know that you've heard them, and you don't let them know that you've responded and actually changed what you're doing, this is where you're going to get disenfranchised staff. This could be, again, why the reason that training is felt it's not engaging. And this is when you're going to start having issues on site. So what we have to look with, and remember, before COVID, we always did what we thought was the right thing. And if COVID's changed that way you communicate, the old saying as it goes, if you've got a hammer, if hammer is the only tool you've got, everything looks like a nail. So if the way you communicated before was face-to-face tailgate briefings, and you've suddenly had to start doing those remotely and you're still doing them the same way, you're perhaps not going to get that same feedback, that same networking with your staff, and that same communication to make sure everyone's safe.
For Jake, Jake, how important is communication at Fulcrum, and what do you do to facilitate it?
Sorry, I actually remembered to unmute before speaking. I come from a vendor's perspective. Obviously, we're a company that helps safety professionals do what they do. And from my perspective, communication is really data flowing from one person or group to another. And at Fulcrum, that's the kind of communication that we really help facilitate. Like what we're doing right now is communicating, and there's information flowing from the speakers to the audience, and the audience is going to have their chance to ask questions and so on. So it's really a two-way street of data flowing from one person to another, from one group to another. So I think there's an opportunity actually to capture more data than we used to capture when we were face-to-face more. So post-COVID, we saw that people shifted from pen and paper somewhat to spreadsheets as a starting point. The data that you might have communicated with each other face-to-face using words and just captured only in your brains can now be captured to some extent by digitizing that and ensuring that it remains captured, that you retain it and are able to use it further downstream. And I think it's important for us to recognize the volume of data that we create. People may not think of themselves as data collectors. You might think of yourself as performing an inspection, but when you perform an inspection, you're actually generating data. You're seeing what a situation looks like. You're understanding what hazards are in place, and you understand what the ramifications of that might be. And all of those are aspects of data that can be critically important to not only the people in the immediate vicinity, but also to the organization at large. So I think it's really important for information technology, and I'll talk about this more a little bit in the future too, but I think it's really important for information technology to support the capture of information and the flow of information across an organization to ensure that it's being used to drive the best outcomes. So from my perspective, clear, consistent data capture, correct data flow, and proper aggregation of that data for use in decision-making are all key elements of ensuring that that we're communicating effectively within our organizations.
I'd love to come in on that point that Jake was making there.
Go ahead,
And I
Keith.
think in terms of that feedback loop, it is the thing that often happens within businesses, and perhaps has been happening more with COVID, where people have been becoming disengaged, is the fact that it's very important. And I used to have this with unions, that when you were having a union meeting, it was about you said and we did. The we did bit from the actual management was the most important stuff. And even if you went back and said, well, you said this was a problem, and we did this, and the we did was, well, we did nothing, at least the person who raised the issue and logged that data knows that it has been considered, it has been looked at, and they've been given an answer. Even if you don't do anything, it's still important to have that feedback loop to make sure that when you capture data, the data, the person that's raised the data, I hope I've got that correct. I was going to say the data raiser, the initiator, that's correct, Jake, isn't it? The initiator must get that feedback to say, do you know what? We've listened to you. We heard what you said, and we have done something, or we have at least considered it and given you an answer. Because if you don't, when people stop being, if people don't believe they're being listened to, they stop raising issues. When they stop raising issues, they don't become engaged. When they're not engaged, that's when accidents happen, because people aren't able to have that communication. So they stop caring, and people that don't care aren't as engaged and therefore not as committed to the safety of everyone they work with, as in the family.
Super. You can't have a good relationship without good two-way communication, and a safety culture is a lot of communication among a lot of people to create the environment they need and the outcomes that that they need from it. I think you're 100% right, Keith.
All right, well, thank you. We're going to go a little more in depth into data in this third section, leveraging data, proactive, not reactive. As you've noted, a significant part of communication is what we might think of technically as data flowing. So improving our ability to be data-driven has to be an important part of our future efforts. With that, as we get into this, another poll question, we're asking, what's your top challenge in taking a more data-driven approach to safety? We've got five options, and please tell us what you think.
When we were talking about this one as well, to figure out what would be interesting for us all, there's always different business challenges related to becoming data driven, and the question is, do we even know what we want from that? Is the problem with communicating what we're getting out of it? Is it that people have not invented here syndrome, where they're kind of protectionist with their data? So all of those are represented here, and you may actually see more than one, but we're looking at the top challenge for this particular case. And that's really interesting. The question is a strategic one, understanding the means by which you'll use the data and how it'll be communicated up and down. Although that's 38%, the others are heavy showing as well. It's nice to see that the protectionist attitudes at least are a little bit on the low end. Keith, I think that was one thing that you had mentioned.
I'm absolutely loving that answer there, and I'm going to wait for Kevin to bring me in, but that's definitely something I've got some points on that I really want to raise, but I'll wait for David to bring me in on that one. Sorry, Kevin.
No problem. I'll bring David in though, but before you, David, this one is for you. Just how important are these kinds of issues to your Safety Nights community, and how are they addressing them?
Yeah. I mean, honestly, when you're talking about data, it's a pretty, you could kind of interpret it like pretty high level. Like you have like big data, that's like your social media data and like privacy data and stuff like that. And then, you have your more like analytic data that you collect at, like your health and safety like person position. So, I think a pretty like, maybe not like trendy is probably not the right word, but a pretty like popular discussion these days is like, leading versus lagging indicators, and, like, are like lagging indicators like even representative of your like safety program, or, should we be switching to leading indicators? So, as far as like what people are talking about on safety nights, that's probably one of the, in terms of data at least, that's probably one of the more popular discussions. And I would say that's true for like all of social media. Like, people are always, arguing about, leading versus lagging indicators. So, lagging indicator being like a total reportable incident rate, or a, DART rate, where, something happens, and then, at the end of the year, you run your spreadsheet and you can track your data that way, that being a lagging indicator because the injuries already happened, versus like leading indicators, which is like your near misses, and then like, your safety observations, and then you get into like behavior-based safety. So I think that's a pretty big discussion in the, in the safety community, is like, all right, like, should we even bother with like lagging indicators or switch to leading indicators? And I think it really depends on like, it's more like case by case. Like, me personally, I don't think the lagging indicators are like totally useless. They're generally pretty easy to calculate. They're like the industry standard, so you can kind of have a comparison. But again, you make the argument like they're lagging, like you can't like predict, use it to like predict stuff. And then, your leading indicators are definitely more progressive, and there's a lot of like new studies out there, and the studies get kind of complex. I read one, and I think they were like going like the partition function or something like that, and that's when I zoned out. But I think I think we're starting to see more like leading indicator models, hitting the mainstream. So, but I think it really depends on your company, and I think generally people kind of like fall somewhere on the spectrum between like, how much you want to rely on your lagging indicators versus how much you want to rely on your leading indicators. And it's just, whatever works best, whatever you think works best for your company, is generally the consensus, because, it's going to be different. So, in terms of data management, I think it's pretty subjective and case by case basis. So yeah, that's what I see on the Safety Nights community on LinkedIn and stuff like that. People are always doing leading versus lagging indicators. So it's a cool thing to think about. But yeah, we'll see where it goes.
Now we will go to Keith. Keith, what's the best way to start collecting the data needed to become more data driven? And should people err on the side of collecting too little data or too much?
You've set the world on light with that last session, David. I've just got to say, so I've got a really interesting thing to bring in here. So David, one of the things you said, completely agree with. It's not about the data, it's what we do with it. That absolutely fully support David on that. But believe it or not, David, if you'd been with me in Germany about 2 years ago, and you'd stood up in front of them and said, near misses are a leading indicator, you'd have seen most of the audience, you'd have seen their heads pop, because it's brilliant. It's very much, and I had someone stand up on stage and say near misses are leading indicators. And Germans are very process different. I don't want to stereotype an entire country, because we could end up, we could get into all sorts of trouble. But the Germans, you see, where they're process driven and they're very much about quality, they view near misses as a lagging indicator because something happened.
I can see that. I can see
absolutely. That. Whereas when you talk to the French, and again, see, I'm just getting into all sorts of trouble here immediately. But when
we're going to get letters about this, Keith. We're going to get letters.
Absolutely, it's fine. I'm in the UK. It's my fault. You can blame me. I'm not one of your countrymen. But one of the things that they said, they're going, but it's a near miss. It's leading. And when you say why, they go, but we didn't kill anyone, so therefore it's a good thing. It's brilliant. And I think bringing back to David's point, which is fantastic, is it doesn't matter whether it's leading or lagging. We don't really care. What we care about is, did you do something about it? And did you fix it? And this is where it's going to come to my next point. The actual question you asked me, Kevin, I'm sorry, I've got to get props out. I've got to move. This is very excitable. But what we're going to talk about here is, look, so many people, look at that. Can you see that graph? That is how a lot of people, so Jake, they'll get hold of your application and they'll go, this is amazing. Can you see how much we can record? We can record all this data. I can work out where they're standing, what they're looking at, what color their shoes are. I can make them tell me what the weather is, all of that. And suddenly their data's gone from this, where they've had a couple of nice leading and lagging indicators. They've gone crazy. They've gone there. And what you're saying, though, Kevin, is I want people to think like that. When you're trying to work out what the right data is, and let me zoom in on that for you there. Okay. Measure what you need to focus on as a business right now to improve success and keep everyone safe. And that's what I say to people: measure one thing, do it well, praise people, reward people, feedback, get that loop of data, that feedback loop to your staff that everything what we've planned to do is good, and then move on. Because we know the people at the front line, if you start throwing data at them, they're going, but I've been doing my job really well already. I've been doing my job well. I do this well, I do that. And all of a sudden you've made my job harder because I've now got to log all this extra data. So I really do think, picking up on the point there, in terms of communication, is it data for data's sake? Are we collecting it because we suddenly can? And is it something we need to measure? And does it help the board make better decisions about improving the company and finding efficiencies? And ultimately, is it there? Does it help us with our Deming cycle in terms of plan, do, check, and act? So I'd say to everyone, take David's point there, which is brilliant, which is about, don't worry about leading and lagging, just worry about doing the right thing with it. Use Jake's, from that point of view of getting the right data to the right people at the right time. But remember, let's pick up on that piece of data we need to make sure it's the right data to do the right thing and to help us get everyone home safe. Sorry, I got a little excitable there.
Oh, quite all right. No,
I liked it.
You're right. Jake, we now ask you, just how do technology providers improve communication related to safety?
Well, there's a ton related to what Keith just talked about, like there's actually so much to talk about, but let's focus on a couple of key things. We know that technology is supposed to be there to facilitate safety programs, to make it easier for us to understand what's going on, to make it easier for us to do the right thing, to make it easier for people to get home safe at night. And there are a lot of different aspects to that should be brought to bear in a safety program. For us, we start with the cloud, and cloud is a technology buzzword, but it really is relatively simple. Like when you log onto Facebook, you're using the cloud. You're not installing software on your computer. You're just using something that's there. And when you make an update to Facebook, everybody who's connected to Facebook can see it, right? So it's really all about, somewhere your data is being communicated correctly. From a safety perspective, to relate it back to safety, when an inspection is completed, there's no reason that everybody can't see what's going on there as well. Everybody should be able to see that inspections are taking place. To a point that Keith made a moment ago, if actually he made a very important point earlier on about what we do when people are concerned about noting that there's a hazard. I don't want to make waves. I don't want to be a troublemaker. Well, if somebody is able to snap a picture of a hazard and that hazard information immediately gets communicated to people who can remediate that hazard, then they're not seen as a troublemaker. They're actually able to see that there is a result. You get the communication feedback loop that you're looking for, and you get a safer environment. So being able to use the cloud in that way, to be able to capture information and immediately communicate it out to all of the stakeholders who are involved in it, really helps create a safety culture. There are other more kind of prosaic things to talk about there, such as reports. I mean, these are, if you have a PDF report, that's durable communication that goes out to supervisors, other stakeholders, even clients. I would guess that many people on this call today are people who are providing consulting services to clients. And those clients need information about the safety process that you are applying to their environments. One thing that we're very focused on is location intelligence, being able to put information on a map so that you can see location-related aspects of your organization's situation. It is amazing sometimes how often you can pick up some interesting trends just based on where things are located. Oh, well, the Northeast team actually seems to have more hazards being reported than the Southeast team. I wonder why that is. And by the way, again, data as communication, the Northeast team also sees has better results, is seeing better results. They have fewer safety incidents. So more hazards being reported, but fewer safety incidents. That's important information to capture and understand. And the technology the capture technology, the ability to see that on a screen, being able to see it on a map, will help communicate the fact that the higher number of hazards is actually a good thing because it means people are reporting the hazards, whereas the lower number of hazards coupled with a higher number of incident rates is actually a bad thing because people aren't reporting hazards that are there, and then people are getting injured on the job. So so that's another aspect of technology that needs to be thought about is mapping and geography. And then finally, I want to briefly mention integration. All of this sounds like technology jargon if you're not used to it, but integration is just a form of communication. It's making sure that you're able to push the information out to the people who need it. Maybe they're doing analysis. You need to be able to push things out to their analytical tools. Maybe you're doing some kind of a process, a safety process, and there needs to be equipment on site. So you're pushing information out to the asset management software that's able to then ensure that the right equipment is in place at the right time. So those are some of the technology factors that we think about: cloud reporting, mapping and location intelligence, integration. And there's a ton more that I could talk about, but I think that might get pretty boring, so I don't want to do that. I think we're getting ready, Kevin, if I'm not mistaken, for audience questions. Is that correct?
Yes, that's correct.
So I just want to take about 15 seconds to mention, now that I've talked a little bit about the technology of Fulcrum, I want to back up slightly and just mention that Fulcrum is really about providing no-code intelligent automation for the mobile workforce. Safety people typically being very mobile. We see that as a strong need in the safety community. We want to be able to maximize that field team performance and agility without writing code. We want to make sure that you're able to ensure your process rigor and compliance. We want to make sure that you're harnessing the value of location and apps for your mobile teams and your safety teams. We want to connect the field with the back office. If you have safety people out in the field, or if you have maybe non-safety people out in the field who also have the ability to identify hazards, we want to be able to connect that with the back office and make sure that we're tracking all of the information that needs to be tracked. And the bottom line is we want to be able to digitally transform safety, quality, and asset inspections for your mobile workforce. So this has been a word from your sponsor. I'll get out of the way now, and let's start moving on to those questions. Kevin, thank you.
Certainly no, and we thank the three of you. Great job, Keith, David, and Jake. We thank you for your insights and expertise and just a truly enlightening discussion. Before we do start the Q&A, just want to remind everyone of the evaluation survey that we're asking you to complete. The survey will open in a different screen after this presentation. Your input's important because it'll help us improve future webcasts, and we appreciate you taking the extra time to offer feedback. I know some have been rolling in, but just a reminder, if you want to ask a question, simply click that Q&A button at the bottom of the screen, type your question, and click the send button. With that, we will get to some questions. First one is for Keith. Keith, when people are satisfied with the old ways of doing things, just what are some of the best ways to get them out of their comfort zone and to start improving their use of data and technology?
You're on mute, Keith.
You're on mute.
One of us had to one of us had to do it, didn't we?
Absolutely.
We made it more than 3/4 of the way. All right.
I've got to say as well, I think we all need to wave, because actually my mum's in the audience as well. So can we all just wave to my mum, please? See, just so I can prove I'm here to her. Anyway, but yeah, so looking at that data in terms of getting that, you are going to go through your change curve. You are going to have that challenge of taking people. As we talked about when I was talking about the different data, how you collect data, you've got to be careful enough in terms of not scaring people into what you're going to do with this. You've got to make people understand that this data has been collected for the right reasons, to make them safer and to make the business more efficient. An example I might give is when collecting hazards for the first time, or safety moments, or whatever you want to call them in your business for the first time. As soon as you introduce a system and you say to people, I need you to collect hazards, what happens is they will report anything because they're thinking it's just another job. So you'll get hazard reporting like, it's raining, the picture was upside down, I didn't like the sandwich in the canteen. And you've got to be really careful not to chastise people at that point of the hazard collection process. Because actually what they've done is, by just letting them submit those spurious hazards, you're kind of tricking them into moving into that habit of reporting hazards, a bit like wearing a seatbelt or driving at speed. Once you reinforce that behavior, so if they report 14 daft hazards and you let them, they've got into the habit of using the app. They've got into the habit of reporting hazards. So let them get into the habit of telling you about stuff, respond to it professionally, but then start coaching them in what a good hazard looks like. What is the data you want? If you punish them too early on, or don't coach them too early on, shall we say, for what they're reporting, they'll stop reporting because they haven't got into that habit of telling you people. So I'm always very mindful of people. When you start putting that change in, just let people go and start encouraging them to tell you stuff. Tell them what's happening, give them feedback. Don't, essential thing I've coached a lot of directors with. Directors have got a habit of telling off people that bring them information. So an accident might happen, you know about it, you go in to see the director and say, do you know this has happened? And the director goes, can't you see I'm busy? I knew about that already. Why are you wasting my time? The individual that told you didn't know he was wasting your time. He thought he was being helpful. So it's coaching directors to turn around and just say thank you to them. Because what will happen is one day they'll come and tell you something you didn't know. And if you punish them now for about things that they're trying to be helpful, they stop being helpful and your knowledge base gets smaller. So it is about encouraging people to tell you stuff, coaching them and saying thank you for them telling you stuff. Then let's help them understand what is useful. What do you need to know before you punish them for speaking up? Because if you punish them for speaking up, nothing happens. So we've got to be mindful. When we start collecting that new data, let's open our arms and let's welcome it like we've never seen it before. And you'll start getting those behaviors. You'll start getting good data, which means you can bring efficiencies into your business and use that data to leverage to do the right things.
Well, thank you. We got a question now for David. What would your advice be to someone just starting out with apps for safety?
I mean, I guess as far as like, building apps or, using apps, I guess my answer doesn't matter, but, I would say safety is kind of like a team sport, which is, I guess, kind of counterintuitive because, depending on the size of your company, if it's like a 50 person company, like you might have like one safety person. So, it can definitely feel lonely at times, but, you need to, figure out how to build your team because, when you want to use like a new app or roll out like a new program, you definitely need to get like buy-in from like, your managers, your coworkers, and, even if they're not technically like safety, obviously like, safety is everyone's job. So, definitely try and build your team. And even building safety nights, like, I started building it like all on my own and probably within like a month of launching, I was like, wow, I need some help with this. So, we kind of recruited some people to help build it. And, I mean, I think that's just indicative of safety in general. If you're trying to roll out a new program at work, get a supervisor, get some workers. And, if you're trying to use a new app, you got to, train people up and get people on board. So, I guess that would be my advice is try and build a team, and it becomes a lot easier to implement the things that you want to implement.
Thank you. This one is to Jake and asks, how do I start getting actionable insights out of the data that our team is collecting?
I think that we saw in the polling question that we have some issues to face with respect to understanding what we need to collect, and Keith's interesting diagrams related to that. I think we need to understand how we're going to communicate what we learn and how all of that information rolls up to higher levels. I think there's a need for us to be thoughtful a little bit upfront about the kind of information we're collecting, and then understand that as we start to communicate it and as we start to roll it up, it becomes important for us to remain flexible about the kinds of things that we do collect. And as we collect that data, we need to be, we need to start with a process, right? We're starting with, we're collecting points A, B, and C. And then we need to add in points D, and E, and F, because those points D, and F matter to the people who are coming to understand information from the data that we're collecting. So I think it's important to kind of just have a good, solid, thoughtful process about how you're getting your information, the kinds of information that you want to collect, and where you go from there as you communicate that information and get feedback from people about what that information means to them. So that's kind of a high level perspective on that. And I think it's important, especially with COVID, in the sense that as we've seen with COVID, the pencil and paper approach to safety has been more difficult, and we've had to move over to spreadsheets. Obviously, at Fulcrum, we would move people into Fulcrum apps, and then we have to be ready to adjust those spreadsheets or Fulcrum apps or whatever it is we're using to track, to catch more of that information and start communicating that information more effectively.
Thank you. We move now to our next question, and it's asking, do you feel that employers will face lawsuits due to employees getting COVID-19 at work over the coming months? I think Keith indicated he'd like to begin with that answer.
I just wanted to give this because there's going to be two very different answers depending on where in the world you are. So within the UK and Europe, there's been very specific guidance issued around what is classed as contracting COVID at work. So there has been, from our enforcement bodies in the UK and Europe, they've made very clear rules. So, for example, if you contracted it in a lab to dropping a vial of COVID sample, then that would be an accident at work, and therefore there is a responsibility, and you would have a claim against the employer for you contracting COVID. So that's really from a European and UK point of view. So I just really, I'm quite interested as well, probably from yourself, David, or someone else want to pick that up from the different litigation model that you have in America to the UK.
Yeah, I mean, I'm definitely no legal expert. What was the question again? Do you feel employers will face lawsuits due to employees getting COVID-19 at work in the coming months? Yeah, I mean, I'm sure there's always gonna be lawsuits. Yeah, I don't know. There's probably some developing lawyer industry of corporate COVID defense attorneys and whatnot, but yeah, no, I don't really have a good answer for that, but maybe someone with a more legal background does.
I don't have a legal background, but if you look at where we are with currently with any kinds of standards coming from OSHA for Keith and anybody else out of the US, that's the Occupational Safety and Health Administration. We've always had to capture documentation. We've always been able to had a requirement to demonstrate that we're following the required, the regulations that are in place. So here again is a situation where capturing data, making sure that we retain that data, making sure that we're able to fully document what we've done, all of that is still comes into play with COVID. So I don't see that, I'm not a lawyer, but I don't see that as a different issue than the other kinds of things we've had to do with respect to, ladder safety and, falls off of platforms. If you still have to document everything that you've done and ensure that that information is available to the people who need to investigate it to make sure that you've done the right things in order to cover yourself legally.
All right. Well, next question is asking, is it possible to have some tools-related COVID-19 training video or a PowerPoint, to sort of asking specifically about tools related to COVID-19?
Yeah, I think I indicated I'll answer this one. Yeah, I mean, there's tons out there. There's probably hundreds of different platforms available that can, meet your COVID, your COVID training and awareness, employer needs.
I was going to say actually, David, I am aware that OSHA have released training guidance which you can download. There's also the International Safety and Security Association, which is the global body for Safety Security Association, have a recognized accredited course on COVID in the workplace, as do the Institute of Occupational and Safety and Health.
Yeah, that's a
those-
good point. These, the agencies definitely, definitely have
Yeah.
a pretty good repository of these types of trainings.
And also the ISO, I'm talking from a British Standard Institute as well. But if I was guiding you anywhere, I'd probably guide you to the Institute of Occupational Safety and Health in the UK, from a point of view that they've produced COVID guidance for employers that also covers the rest of the world as well. And it's just good guidance. It's based on the World Health Organization guidance on what are the right things to be doing as an employer.
I think we've got time, guys, for one more, excuse me, one more question. Can technology help to drive leading indicators? Or to drive the use of leading indicators, that is.
Speaking for myself, I think Keith or maybe David, you're the one who brought up leading indicators, but technology is definitely useful for capturing leading indicators because you need to have some points to measure. And only after that point has been measured do you know that it was that it could lead to something, to a significant problem. So, for example, if you have a leading indicator related to ladder safety, you're seeing that there is just making stuff up here, there's a significant accumulation of rust, and as you see rust accumulate, you're starting to see more people slipping, then you can start to make that correlation. So you need to be able to have data in order to be able to define what is a leading indicator. You will identify what those leading indicators are over time. And once you've identified them, you need to be able to capture that data in order to then say, okay, well, I'm seeing an uptick in this particular problem, rust on a ladder, so I might expect more ladder slips. Therefore, I need to make sure that I'm taking care of that problem. So absolutely, technology, specifically data capture and analysis, is really critical to managing leading indicators.
Just really to come off Jake's point there, the answer is yes. And the reason technology can help is because it can make it easier to get the right information into that system to do the analysis. So you're getting the technology to do the heavy lifting, whereas previously you'd have to fill a form in, you might have to find a pen out the truck, you might then have to find the form, you might then have to fill that in, you've then got to post it. If you're spread over a large area, how do you get it there? With technology, you fill it in on the app, it goes straight into the cloud, it's live data they can look at immediately, and also you can have data validation done on the device, which means that you can make sure people are reporting stuff into the right categories so that it makes it easier to analyze almost instantly at the head office or with the supervisor. A supervisor can be sitting 50 miles away. He can look at the data from 1,000 jobs that morning and he can see patterns emerging as we speak. Without technology, you might have been waiting a week to have that kind of understanding, feel, or knowledge about the data being captured in the field that morning.
Okay, well, again, guys, thank you. Unfortunately, we've run out of time, so I'm sorry we didn't get to everyone's questions, but all of today's unanswered questions will be forwarded on to our speakers. Once again, we do hope you take the time to fill out the evaluation survey and provide your feedback. With that, we end today's Safety and Health Magazine webcast. I'd like to thank Keith Hull, David Janicki, Jake Freevald, everyone at Fulcrum, and all of you who listened in. Thanks and have a great day.